How's everybody doing? Fantastic. Well, I'm delighted to be with you today to speak about a topic that we're very passionate about at HHS, which is unleashing the power of our data and the power of open innovation to improve health and healthcare in America. Specifically, I'd like to talk to you about something called the Health Data Initiative. How many folks here have heard of the Health Data Initiative? Okay, so most haven't. That's good. All right. So this will hopefully be edifying and educational for folks. So the purpose of the Health Data Initiative is to turn HHS into what we're calling the NOAA of health data. NOAA is, of course, the National Oceanic and Atmospheric Administration, and it famously collects tons of weather data and publishes it online in machine-readable form, downloadable by anybody for free, without intellectual property constraint, which has then seeded over the decades a massive array of innovations in the private sector, ranging from weather newscasts to weather websites, weather insurance, weather mobile apps, and much, much, much more. The government ran a similar play in the 80s by liberating GPS data, which now, of course, feeds everything from Foursquare to supertanker navigation systems, everything in between. And this is the latest effort by the government, Health Data Initiative is, to run this play, open up public data, and stimulate massive innovation in the private sector, this time to improve the health and healthcare of the American people. The core aspects of the play are actually quite straightforward. First of all, we're publishing brand new HHS data for public access while rigorously protecting privacy and confidentiality. We'll talk more about that. Secondly, critically, we're making existing publicly available HHS data actually much more usable. A lot of our data that's public is public in the sense that it's in books, publications, PDFs, or static websites. We're now taking that information and turning it into computable data sets, downloadable, machine-readable data, accessible via APIs, so that developers and third-party services and applications can ingest the data and turn it into much goodness for the American people. And then finally, because a relatively unscientific but nonetheless definitive survey of American innovators indicated that approximately 98% of the folks that could use our data to produce value didn't even know we had the data, let alone that we're making it available, we are marketing the bejesus out of our data to the innovators of the world to make sure they know it's there and can use it as raw material to develop applications and services that help improve health and healthcare. So what kinds of data are we liberating, you might ask? Well, it's impossible to describe all of it, but let me describe several principal categories and then a few examples within each category to give you a sense of the gestalt of what we're talking about. Community health data is one great category at the Health Indicators Warehouse, which we published in February of this year. We've made close to 1,200 different metrics of community health, healthcare system, determinants of health performance by region across the country available. Everything from smoking rates to obesity rates to the first ever Medicare indicators of utilization of services by type of service across the country, indicators of prevention and quality like admissions, readmissions to the hospital by condition or ambulatory care sensitive admissions by condition, determinants of health performance like access to healthy food. This data is now available at the regional level across the country via the Health Indicators Warehouse, and not just via a website, but via a web services API, which is how people are really utilizing it in great depth and breadth. A second category is provider directories and quality data. So we're making machine-readable directories of healthcare providers and human service providers across the country available. Everything from federally qualified health centers to mental health treatment centers to directories of services that can help the elderly age well at home, like Meals on Wheels, counseling, et cetera. We have actually a very powerful set of data on hospital, nursing home, dialysis center, home health agency quality called the Compare data sets. It's been out for a few years, but just this past September, the Centers for Medicare and Medicare Services attached APIs to these data sets at data.medicare.gov, which make them exponentially easier to use and incorporate into other applications and sites and platforms. And then finally, have you heard of Section 10332 of the Affordable Care Act? No? So this is actually an incredibly sexy provision of the Affordable Care Act, the health reform law, in my opinion. And it's a provision that goes live January of 2012 that allows Medicare to provide to any qualified public or private entity detailed Medicare claims data for the purposes of these entities matching it up with other data, other payer data, et cetera, to produce quality reports about doctors, hospitals, et cetera. It's a massive democratization of access to our data for the purposes of quality reporting and healthcare transparency. Has everyone here heard of Blue Button? Okay. Well, for those of you, for the guy who said no, and for those of you who said no, this is something that I expect Peter Levin at the VA will talk more about later today. But the Blue Button is a joint venture led by the Veterans Administration, of which HHS and DoD are also a part. And it's an incredibly simple initiative. based on the supposition, the proposition, that people should be able to download their own health information because it's their data, not ours. So what happened is that the VA, HHS, and DoD deployed a blue button on my Medicare.gov, on my HealthyVet, and on TRICARE Online that allows Medicare beneficiaries, veterans, and members of the military to, for the first time as of last October, hit a blue button on these secure portals and download a copy of their own data. Download a copy of their own claims data, download a copy of their own personal health record. And at the time, we actually didn't think this was that big of a deal, quite honestly. It just seemed to be a simple, beautiful new feature to add. The VA did a private projection that said that if Blue Button blew the doors off, that maybe 25,000 veterans would download a copy of their own data. Well, I'm happy to report that as of now, over 430,000 Americans have downloaded a copy of their own data, on average more than once. And even more interesting than that, potentially, is the fact that the private sector is now copying Blue Button. In fact, when we first deployed Blue Button back in October, we got a series of calls from people in the private sector. And the questions that were asked us were basically along the lines of the following. Are you allowed to do that? And we said, well, what do you mean? They said, are you allowed under HIPAA to give patients their own information electronically? We said, yes, yes, you are. But actually, I think no memo, no communique we could have possibly issued was more powerful than simply doing it ourselves and allowing beneficiaries of Medicare, TRICARE, and veterans to download their own data. So Aetna has now downloaded, has actually now implemented downloadability, implemented Blue Button for 10 million Americans who use the Aetna Personal Health Record. United Healthcare is going to do the same thing. Walgreens is doing the same thing. The state of Indiana is doing the same thing. Vermont is doing the same thing. So Blue Button is actually beginning to spread as a way for people to get their own data. And we're very, very, very excited about that growing movement. You can go to bluebuttondata.org to learn more. We're making consumer product information more and more available. So FDA, as of last October, made recall data on devices, food, and drugs downloadable in XML format for the first time. Also, we have a site called healthcare.gov that we launched last year that has the first ever truly comprehensive compendium of public and private health insurance options by zip code across the country that are open and available for folks. We made the directory of those products and services downloadable as of last August, this past August, just a month ago. Medical and scientific knowledge. Anyone here from NIH or NLM? Woohoo! Okay, so NIH and NLM, the National Institutes of Health and the National Library of Medicine, have been doing open data since long before it was cool to do so. Woo! But they keep raising the level of their game, and showing the rest of us how it's done. So for example, last September, they launched the NLM API portal, which is a portal to a whole host of APIs that are incredibly awesome, like clinicaltrials.gov, an API to every clinical trial in America and many countries around the world, continuously updated. Pillbox, an uber awesome new API that has detailed info about pills and tablets and a growing repository of high-resolution images of pills and tablets, which you can imagine being incredibly useful for all kinds of purposes. Have you heard of Medline Plus Connect? Medline Plus Connect illustrates that when we talk about data, we're not just talking about numbers, we're talking about qualitative information as well. So Medline Plus is a website that NLM has been running for quite some time that is a continually updated compendium of the latest and greatest medical and health information for patients. What Medline Plus Connect has done as of last November is a team at the NLM broke down all the content in Medline Plus into specific packages that are mapped to individual diagnoses and individual medications. Now, as a free service, any electronic health record, personal health record, other application can query Medline Plus Connect and say, I'm interested in this combination of diagnoses and medications that a patient of mine might have. Then Medline Plus Connect will spit back a customized XML package that is a patient education package for that situation in particular. Incredible, incredible stuff. And bringing data right into the flow of where the doctor and patient need it. One of my favorite laws of the data universe is something I call O'Reilly's Law, which I named after Tim O'Reilly, who said to me once, look, Todd, if you want data to help people, don't make them find it. Make the data find people where they need help. So Medline Plus Connect is a fantastic example to me of this, as opposed to sort of making patients get out of their head or doctors get out of their workflow and find a Medline Plus site or some other site. Simply have customized information targeted for that patient show up in the workflow of the electronic health record in the doctor's office or the personal health record. So a great example of O'Reilly's Law in action. Government spending data, as of the first half of this year, we made the first ever Medicare claim level public use files available that are available for free without legal agreement. Now to do that, we actually had to redact the data pretty significantly to ensure that the claims could not be re-identified. joined with other data on the internet to re-identify Grandma Jones. So we had to take a lot of data out, but it's still actually an incredibly rich multidimensional picture of what's going on in terms of Medicare spending in the healthcare system, and is now available for each major type of care, hospital, physician, drug, et cetera, for public download without any kind of constraint. And because that's all actually really hard to keep track of in one's head, it's only a small smidgen of what's available, we launched a new site on data.gov called health.data.gov in February of this year. That's the one-stop shop to get all of our free, publicly available data, and more stuff is being added to it all the time. And in fact, the Secretary Sebelius, is so excited about this that she recently issued an executive order that directs every HHS agency to publish and update every 6 months a data liberation plan, a plan to actually publish more and more data and make more and more data accessible to developers to help feed the ecosystem of innovation that is arising around our data. And, as I mentioned earlier, it doesn't do any good to chop down data logs in a data forest so people can build them into houses if people don't know that you've done that. If all we had done is publish data, very little would have actually happened. So we're engaged in a big effort to market the bejesus out of our data to the innovators of the world so they can turn it into beautiful things that help the American people. It's been a rather unconventional campaign by HHS standards, but one that's been wildly successful, actually, beyond our wildest dreams. So we've been engaged in challenges and codathons, working with an organization called Health 2.0. Dozens of challenges issued, not just by us, but by foundations and companies to build cool apps and services using health data. We've been doing codathons. Everyone here been to a codathon? Who here has not been to a codathon? Oh, you should totally go. I mean, it's so much fun. So the best analogy I could actually draw is, have you seen the movie Social Network? Remember the scene where Mark Zuckerberg walks into this room and there are a bunch of cheering college kids? And there are these two kids sitting at computers and they're coding and drinking, coding and drinking, coding and drinking? And they're competing to become the next employee at Facebook? That's a codathon, which we are doing without the drinking. No drinking at our codathons. But they're producing fantastic results nonetheless. So this actually is a picture of a team of 5 young people that won the Georgetown University Health Data Codathon this last February. They're a team that calls themselves Team Maya. They're from Pittsburgh, Pennsylvania. I don't know how they heard about the Georgetown Codathon, but they got inspired. They bought lab coats with matching insignia. They rented a van, got up at O'Dark 100 and drove, for some reason, on a cold Saturday in February to get to the Georgetown Codathon in time for it to launch at 9:30 a.m. They had no prior experience in health and healthcare. And over the course of 8 hours, they scrubbed into our data, had an idea, and built a working prototype, which won the codathon. And the prototype is actually something called Food Oasis. It's a brilliant answer to this issue called food deserts. If you look at our data, USDA data in particular, you'll see vast swaths of America where you can't get access to healthy food, which is a serious health issue and issue from lots of other perspectives. So Food Oasis is this brilliant, simple mashup of text messaging and farmers markets, where people in the food desert can text in that I'm interested in buying a zucchini, 5 heads of lettuce, and 10 tomatoes. Other people do the same thing. It goes into a central website where farmers and co-ops and food suppliers circle the orders they want to fill, hit respond, and say, show up, everyone, St. John's Church on Friday at 3 p.m., and I'll have food for everybody. I'll have your food. And I don't know much about the food business, but basically it turns out that if you don't have to maintain physical infrastructure in a food desert, if you know demand in advance, and if actually all the food gets bought when you show up, the cost of food tends to go down. So it's really interesting answer. And what's going on is that a major corporation is looking to invest in these folks and beta them in 7 cities. More cities are interested. And it all happened because they got inspired and went to this codathon. We've been doing lots of innovator meetups across the country, dozens of meetups with innovators, entrepreneurs, investors, students of all kinds. And we've been doing annual health Datapaloozas. If you're wondering what a health Datapalooza is, it's a new annual event that the Institute of Medicine and we have been convening. The secretary hosted it. The latest one was June 9th of this year. What happened is we did an open call for innovations. Any product or service had been built, fueled in part by our data, that helped consumers take control of their own health and healthcare, make better decisions, help doctors and hospitals deliver better care, journalists write better stories, employers promote health and wellness, local policymakers make better decisions. And we said it also had to have a sustainable business model. We weren't interested in concept cars that no one would ever drive. We're only interested in products and services that would be deliverable to actual people today. Even with these criteria, these relatively rigorous criteria, at an early stage in the Health Data Initiative, we were overwhelmed by the number of people who wanted to present. So we ended up doing an American Idol-style bake-off process to select the top 50. I was an observer. People joked that I was Paula Abdul because I was weeping constantly. I loved everybody. They were doing such phenomenal work. They were so talented. They could all go all the way. All the way. But fortunately, our judges were much more discriminating, and they narrowed it down to 50 who actually presented. And these videos are actually now up on both the Institute of Medicine's website and Health 2.0. And if your faith in America right now is wavering even a smidgen, go watch these 50 videos, because it's the most awe-inspiring display of American mojo I've ever seen. And I can't describe them all to you. You should watch the videos. But just general categories. There were a whole set that help consumers take control of their health and healthcare by putting information at their fingertips to help them find the right provider, book appointments with those providers, to get the right information about their condition, to actually find the right clinical trial in their area, to be notified proactively about a new clinical trial in their area that could help them and could save their life. There were a whole other set of applications and services that are arming doctors and hospitals with platforms and capabilities that help them engage their patients, coordinate care, manage health proactively, do the stitch in time that saves the hospitalization, powered in significant part by our data. There's a whole other set that help communities improve health, something called Ozioma, which is built by a genius team at the University of Washington, St. Louis. That's essentially a virtual health research department for bloggers and journalists that takes 98% out of the work out of writing a story about health disparities in your community or other issues, crunching huge amounts of government and other data. There were a lot of announcements that people made. EPA launched their Apps for the Environment Challenge. Walgreens' CEO came by to announce that they were launching at Walgreens a new position in Walgreens across the country called Health Guides, which are essentially free health concierges that will navigate people through the healthcare system, connecting the resources that they need for free in a human-to-human interface, powered in part by our data. Many challenges were launched by folks, inventathons. University of Michigan announced the first graduate degree program, master's degree program in consumer health informatics, a joint venture of their School of Public Health and School of Information that is aimed at producing more people like the people that built these different apps. Startup Health, a new combination of an incubator, mentorship network, entrepreneurship training academy that's seeking to start 100 new health and wellness companies a year, 1,000 over the next 10 years, many of them powered by open health data. A new health data consortium got launched that's taking over the health data initiative going forward. It includes us and Institute of Medicine, but many other folks led by Robert Wood Johnson Foundation, all dedicated to promoting the use of open health data to improve health. And the whole point of all this work isn't just to publish data or even for a specific set of apps to be built, products to be built. It's to catalyze the creation, the emergence of an ecosystem of innovation that sits on top of open health data and produces an exponentially mushrooming array of products and services, ingenious and creative new innovations that help consumers, employers, care providers, journalists, local leaders, and more improve health and healthcare. Decentralized, self-propelled, beautifully chaotic, that's the ecosystem that we're aiming for, and it's already here. It's already here. The health data ecosystem is out of control, and we could not be happier about that fact. So that's really the gist of the Health Data Initiative. We're incredibly excited about it. And it's something that has really gotten a ton of traction. If any of you are interested in learning more about it and sponsoring a little meetup and actually liberating data that could be related to this at your agency, or just simply learning more about what's going on, you can contact me at todd.park@hhs.gov, todd.park@hhs.gov. I got a protocol, which is that if I don't get back to you in 5 days, hit reply again and write "you idiot," with a subject line, because I sort my Outlook by "you idiot" to actually see all the people I haven't gotten back to. We'd love to hear from you. Join the ecosystem. It's a ton of fun. Build cool stuff with health data. Save the world. Create jobs. And may the force be with you.